Tonight, the people from Provision Center for Proton Therapy are here with us. They say our guest on Tuesday, Craig Griffith, was wrong when he said proton therapy for cancer treatment is not any more effective than traditional radiation therapy. That argument is important because right now, Provision is fighting for a bill in the state legislature that will require insurance companies to cover proton therapy for anyone who needs it. Bill Hansen with Provision Center for Proton Therapy is here. Thank you so much for coming in.
Well, thank you for having me.
Now, we heard a lot from Craig on proton therapy, but we want to hear your side. What did you disagree with?
Well, I think the biggest thing is that there's been a lot of reports that have pulled up information that is really old and kind of out of date as far as really where proton therapy is today. And for us, we've got reports recently, studies that have come out of the University of Florida, for instance, that shows that proton therapy is much more effective and has improved dramatically in the last few years.
So you're talking about much more effective than things like chemotherapy and other treatments?
So, yeah, more effective than radiation therapy that is typical with x-rays, and not necessarily chemo because that's really a different type of treatment that we're dealing with. But when you deal with prostate cancer, for instance, the report out of Florida showed that men were 5 years out of treatment were 99% cancer-free. You know, that's astounding now from a standpoint of people that are dealing with cancer and dealing with treatments for that.
And where we were 10 years ago.
And 10 years ago is very different.
Yeah, absolutely. Let's talk about, because I get this question a lot, what about the cost of proton therapy?
Yeah, again, that is a little outdated when people are looking at reports. The example I'll use is even just now here at Provision Center here. When we do prostate cancer patient, we're able to do those treatments in half the number of treatments. Therefore, the costs have dramatically changed. We're now at the cost or even lower in some cases of traditional treatments. So that's why we're having a hard time with the insurance companies not paying for it.
Yeah, and is this going to affect our insurance rates if this goes through?
It really shouldn't. You know, the insurance companies want to push that, and I think their lobbyists in Nashville want to make people believe that it would. But the truth is that in general, those costs should go down, and over time they should go down even further. And the fact that it causes very few side effects and latent types of issues, those costs should even be much lower over the life of the patient.
You mentioned some of the studies, University of Florida. How much has proton therapy been tested, and for how long?
Well, you know, proton therapy's been around since the 50s. We've treated over 90,000 patients worldwide with this treatment. You know, the FDA cleared it back in 1988 for treatment, so it's not experimental, and it's very, very much proven for what we're doing. And it really is just a matter of getting the word out and getting people to understand it better.
We've covered when you came here, the grand opening and all of that. Let's talk about the importance of it being here in East Tennessee, one of few sites across the country, and how important this bill is in the legislature to East Tennessee.
Yeah, I mean, for us, it's really this important. You know, it's one of only 14 in the whole nation open now. We are lucky to get proton therapy in East Tennessee, and not only is this center treating patients today, but we are also, you know, half of that center is for research and development in the next generation of proton therapy, which will generate thousands of jobs for East Tennessee. And that insurance bill is really what's handcuffing our ability to really progress with that. And we really think that passing that and helping to get that through is really, really important for the entire state.
And making sure we have this correct, that children, pediatrics are covered, right? In many insurance, it's adults that fall between kids and seniors that we're talking about, right? For insurance.
And it's not only just those adults that are covered, it's mainly Tennessee only. We treat patients in Georgia, we treat patients from South Carolina, we treat patients from Kentucky, but we are not able to do that same thing here in Tennessee, and that's really what is very frustrating for us.
And maybe we'll get an answer next week, is that what you're hearing?
We sure hope. It keeps getting pushed out, and the lobbyists up there are really, really good, but we hope to push it through.
All right, Bill Hansen with Provision Center for Proton Therapy, thank you so much for being with us.
Thank you for having me.